Now taking a look at some health news from Virginia, the Richmond Times-Dispatch reports COVID-19 cases are dropping, suggesting that the state may avoid a January surge. COVID has surged in each of the past two Januaries, and this time last year, Virginia was engulfed by the Omicron variant, which led to the highest number of hospitalizations since the pandemic began. But in each of the past 8 days, hospitalizations have dropped, reversing a 7-week trend of rising numbers. For the past 2 weeks, COVID metrics have showed good signs across the state of Virginia. The percentage of emergency room visits with COVID-like illness has dropped from 20% the final week of December to 14% last week. The number of reported cases in the same time frame fell from 16,000 down to 9,000. The number of COVID-associated deaths, which remain low, hasn't dropped as of yet. According to the Times-Dispatch, deaths are typically a lagging indicator, and in the past 3 weeks, deaths have been steady, averaging about 13 per week. Now, those figures are much less than in August when there were more than 100 deaths per week. Sometimes death numbers aren't updated until weeks after a death occurs. Several COVID variants have spread through the state of Virginia in recent weeks. Sequencing conducted by the state health department showed the XBB 1.5 variant represented about 40% of the cases, followed by BQ 1.1. That accounted for more than 30% of the cases across the state. The prevalence of XBB 1.5 in Virginia is mirroring a national trend. Now, the variant likely isn't more severe than other strains, but it can infect those that have prior immunity. That's why health officials are recommending residents receive bivalent booster shots, which are designed to stop the new COVID variants. About 1.3 million Virginians have received a bivalent booster. The majority of the recipients are over the age of 65.